What's up, everybody? Welcome to another episode of Outside the Box. And this is a special edition because whenever we have new additions, we like to talk to them, get to know them. We feel like you guys got to know the providers of performance medicine. And I'm with one today in Pratik Vaidya. Pratik, how's it going, man?
Yeah, it's doing great. Thanks for having me on the show. Really appreciate it.
So what I want to do today is I want to get to know you a little bit better so people can know kind of when they see your face in the office, kind of who that guy is.
Yeah, I appreciate that.
Because you're more than just a physician's assistant, in my opinion. You're
I appreciate that, yeah.
There's a lot to it.
Yeah, I'm definitely a little background on me. I'm from Chicago, born and raised. Became a PA about 2 years ago in 2019. I went to Chicago Medical School, or Roslyn Franklin Medical School, up in North Chicago. Always had an interest in medicine.
From a childhood.
Yeah, it's kind of ingrained in the Indian culture to go into medicine, but I've always taken care of my grandparents, and they've had a lot of medical disorders with diabetes, high blood pressure, gout, and with them not speaking English, I would always take them to their doctor's appointments. And I kind of got in early.
What age are we?
We're about 14, 15. My dad would drop me off, and then I just sit there and translate. And you went
to the doctor's office with them?
Yes. So anytime they had any issues, I'd translate between the doctor and my grandparents. So it was kind of nice to get a little background on their history, understand why the doctor did this and that, and kind of went that way. And
so you're like a patient advocate in that sense.
Yeah.
One, because I love the term patient advocate.
Yeah.
And so you were that for your grandparents from an early age.
Exactly, because especially with the language barriers, in bigger cities, we kind of see that as a huge issue where they don't get the care they need because they're afraid to go talk to their healthcare provider. They think they're not going to understand the cultural issues, or even when it comes to their health, when they have small questions, they think they're inconveniencing that person by asking that question. So they just don't ask the questions, or if their health gets really bad, that's the only time they go see a doctor.
So do you think that's part of the hang up people have in terms of why they don't go and see the doctor more, is because they either are they're afraid of the unknown?
A little bit, yeah. They feel like it's not that big of an issue, even though it's affecting them day to day. They just feel like if they make an appointment, they can't translate that over in a way that the doctor will understand the grave issue that they're having. So they just think that it'll go away by itself. And in reality, you should really see your doctor whenever you have a question. They're always there to help you.
So, that experience, how did that impact you as you became a PA, and as now you're on the other side of it, and people are coming to see you? How did that impact you in terms of how you're helping that patient? Are you kind of coming from more of an empathetic perspective? Because man, I think this gets missed. I think it's more difficult than people realize to go to the doctor. So when someone comes in to see you, you're like, man, you took all the effort just to make the appointment, to come in here. There's obviously, a financial responsibility for coming in. So how does that impact you as a PA?
Yeah, so I've kind of seen both sides of medicine. So I used to work in a huge trauma center up in Chicago. And when I was in urology, we would actually see about 90 patients a day. So on average, you spend about a minute or two with the patient. And of course, when there's, like you said, they're spending all this money and time to see you, they have concerns that they want to relate that to you. But when you only have 2 minutes, you really can't get through everything. Here in performance medicine, the one thing I really love is that I get to spend time with my patients. If it's 30, 40, 50, even an hour, to really go through your concerns and really make you feel at ease. You're spending your time and money to see us. I want to make sure that everything is taken care of and that all your questions are answered. So when you go home, you feel at ease that you're actually in control of your health. And I feel like a lot of patients don't always feel that way. So it's kind of great that I kind of see both benefits. And here, I love to spend time with my patients and get the time to get to know them.
So you say you spent a lot of time in urology. Any other areas of medicine that you spent time before here?
Yeah, I worked in surgery, outpatient surgery specifically. So I did a lot of nephrectomies at Mount Sinai Hospital in Chicago. We worked with different types of cystoscopies when it came to urology, a lot of GI procedures like colonoscopies and EGDs. I worked with podiatry for a little bit. It was a lot of outpatient care, so a lot of pre-op for patients, making sure they're optimized on their health. And when they go home, a lot of patient education to understand why they're on this medication, what are the side effects, and what they could do better with their health when they get home. And one thing when you're at a big surgery center or big hospitals, you don't really see a lot of the supplemental care you kind of get here.
What do you mean by supplemental care?
Like just understanding that outside of that, focus on losing weight, understanding what the disease is and what to do about that, not just keep piling on medication, which I love that performance medicine takes a step back to attack the core problem. And I've been always a big believer in Indian medicine. We use Ayurvedic medicine, which is a lot of turmeric, anti-inflammatories, things where you're not taking a more natural approach to taking care of their health. It's easier to take a natural approach than just piling on a bunch of medications. I feel like patients could be more resistant to adding on, especially when you get into the polypharmacy with multiple medications that they're on.
So polypharmacy means, I'm assuming it means you're on lots of different medications from a multitude of specialists.
Exactly. So it's easy. Like when I see patients in the clinic, I look at their chart and they're on 15, 17 different drugs. Some of them where doctors don't spend the time, or even a pharmacist at these major hospitals, to look through and be like, you don't need to be on this anymore. You shouldn't be on this. If this is resolved, why do we need 4 blood pressure medications where they optimize on one medication instead of 3 or 4 of them? Yeah. So I don't think a lot of providers take the time to do that, especially if you're at a big, busy hospital and you only have 2 to 3 minutes to spend with the patient. So we get to spend time with patients, which is really, really great.
Yeah, and I mean, coming from that area too, with that experience, I'm sure helps, because you're seeing it from a different lens, and you know kind of what they've been through. Patients, meaning patients when they go to a surgery center or they go to a specialist, and the tendencies just based on the system. And one thing I love that you're bringing, the Indian medicine in as well, which is a more natural approach. Yeah. Can you tell me, I'm not educated on kind of the philosophy of Indian medicine. Is it just, I know turmeric and all that. Is there anything else?
Yeah. So we like to, what a lot of Asian populations kind of struggle with diabetes because their diet's higher in rice, bread, more carb heavy. So there's other ways to manage diabetes besides being on metformin at a high dose. Of course, metformin plays a huge, crucial role, but there are other things you could definitely do about your health in the background, which would be lowering your carbs, eating maybe or taking more turmeric or cinnamon into your diet, which are naturally bring down your blood sugars as well. Yeah. So there's different things you could adjust in your diet, but just more supplemental care, just like the cinnamon or turmeric you could take to hopefully advance your care in general, not just piling on a higher dose of metformin or another medication on top of it.
Well, and on top of that experience, you have type 1 diabetes.
I do, yes.
And as do my brother and sister. And has that impacted the way you see people that come into the office at all?
Definitely has.
I know, just because I've lived with 2 people with type 1 diabetes, it affects your lifestyle.
It definitely does.
And we often talk about how, we feel like most people should eat and live like someone with type 1 diabetes. Can you just kind of speak to that?
Yes, 100% correct. Honestly, if most of my patients were on a diabetic diet, I think there'd be way less patients that are diabetic in general. Yeah. But I lived with type 1 diabetes for about 9 years now. Okay. So about 9 years now. Yeah. Okay. It's hard to say it in person, but it's really easy when you see patients and they see physicians or other providers and they just add on another medication, but the supplemental need or the other patients saying they're concerned about their sugars, it's hard to empathize with them when you don't really have the disease yourself. Got it. It's easier when the patient tells me I don't feel right when I'm taking this, or I have a side effect of this issue, or I feel like changing my diet here and there is a little bit more difficult. I've been through all that. I know changing your diet is a drastic change, especially if you have kids and you feed your kids one thing, but then making a separate meal for yourself and your husband or wife or whoever, it's hard to create a good regimen. And I've known how hard it is. When patients are on medications and say they want to get off it, I understand. Sometimes being on insulin is just a really hard thing. Giving yourself injections every single day, it gets tough on you. And sometimes you're like, I just want to give up. But I definitely understand that. I feel a lot of physicians, when they're not in that shoe, they kind of say that, no, just keep continuing it. You need it. It's fine. We'll add on another medication, get better glucose control. But there are ways that you have to get around that. And when you change your mindset, you live a healthier lifestyle, it could happen. And I definitely could work on patients and getting into that good regimen.
Any, practical pieces of advice that, you tell a lot of the people that come in to see you in person, what are some of the tips that you give them when they're going through changes like that? Because I think everybody can relate with, knowing maybe what you're supposed to do and what you need to do, but, also seeing the difficulty and the hassle and, can you just kind of, what are you telling patients in the room?
I definitely tell patients everything in moderation. I have a huge sweet tooth. I grew up my parents having a Baskin-Robbins ice cream shop, and I love my ice cream, but you can still enjoy the things you really like just in moderation or switching over to an alternative. For instance, I love ice cream. I switched over to Halo Top. That has a very low carb count. It's a frozen yogurt and ice cream. and I can still enjoy my sweets, but with an alternative. Or I love rice, and a lot of Indian cooking has a lot of rice built in, but I've switched over to a cauliflower rice blend instead, which is extremely low in carbs. It's very healthy. It has more water that you're able to soak up. So if you add flavoring to it, it tastes really good. So everything in moderation, changing small parts of your diet. I'm not telling my patients go straight to keto where they're eating less than 20 grams a day. Making those huge lifestyle changes are not sustainable. I feel a lot of patients kind of fail easy, especially when they're on those diet plans. They feel they get really frustrated when they don't lose weight. The goal, I think, with a lot of patients, especially with me, is every day create a regimen where eating 50 to 60 grams of carbs a day is a good balance in between keto and too much carbs. And I tell them, if you're able to maintain a good lifestyle, it doesn't become like, oh, it's something I really need to push myself to do. You end up enjoying it, and it's very easy to follow.
Yeah.
And I tell patients, you know what? Try to stay active. It's definitely one of the more important things to do. With diabetes, you are at a higher risk of getting complications with wounds, slower healing, other damage to the nerves, eyes, and kidneys. Just keeping yourself active, maintaining a good diet overall, enjoying, like with the holidays coming around, you can definitely enjoy a little bit if you want, but don't go overboard.
No, I love that. Everything in moderation. And, you know, I can hear the passion in your voice. And I know,
I appreciate it.
At Performance Medicine, you know, we do a lot of different things.
Yes.
Anything that, you know, you're really connecting with, like what's your favorite type of visit? What's that favorite type of patient you see that comes in through the door?
Yeah, I love when my patients come in, they're diabetics and they're like, I want to start getting off these meds. The ones that are on a high dose metformin, they're on multiple other medications. They just want to start peeling back. And I kind of attack the core reason their problem. They're on the medication because they're overweight. They're not really eating a great diet, and really sitting down and counseling them for 30, 40 minutes, going through, breaking down what they eat on a day-to-day basis, why they're eating that, what makes it so difficult around their lifestyle that they're doing this, understanding their habits and their values gets me a good idea. What could I really change? Because when we get to the core reason, they're more likely to stick to that diet or more likely to stick to the medication when they understand it better. So seeing those patients come in, learning about their problems, learning about who they are, and spending the time to start taking that off and building a lifestyle with them. I think when I see them again in 6 to 8 weeks and I see they're so happy, they lost 10 to 15 pounds when I put them on Ozempic, they've changed to a lower carb lifestyle. It's always really gratifying to understand, like, wow, you're doing it.
Yeah.
I did that, and you're working toward a better goal.
I love that. I love that. You're bringing empathy to medicine.
Yes, definitely. I like to think of that way too.
I dig it, man. Well, we're certainly so pumped that you're on the team.
I appreciate you guys having me. Yeah.
We appreciate you coming in, and you're in the Kingsport office.
Yes.
Working with Dr. Rogers, and man, you're already making a huge dent into performance medicine and every patient that comes in. So we certainly do appreciate you.
I appreciate it. Thank you for having me again. I'm really excited to continue seeing patients at Performance Medicine and look forward to seeing everyone.
All right, Pratik. Guys, this is the Meet Pratik episode of Outside the Box. You can check out Pratik in the Kingsport office, and we're going to get you back on the show. We're going to dive deep. There's so many areas that I want to go further into.
Yes, we definitely will.
You'll be seeing a lot of Pratik here soon. Thanks, guys.
No, don't go away.